Welcome back, students. Let's proceed with Section 2 of the Overview of Diagnostic Tests, Part 2. The objectives covered in this section are as follows. You'll be able to describe each of the categories of tests that are commonly performed. This is a continuation of the content we've covered not too long ago. Additionally, you'll bring information from this presentation to the clinical practice setting, as well as information from your textbook to the clinical practice setting. Please be sure to review the content in your textbook on Chapter 24. You'll be able to perform patient teaching for a patient receiving or undergoing a magnetic resonance imaging, also known as the MRI test. Let's begin our discussion with ultrasonography, or sonography. It is a non-invasive method which is used to visualize soft tissue structures of the body. This particular procedure is quick and is conducted with little pain or discomfort. Sonograms are produced using high-frequency sound waves that pass through the body. They are used to diagnose pathologic conditions of various types, such as pathological conditions of the uterus, ovaries, prostate, pancreas, gallbladder, lymph nodes, thyroid, eyes, and peripheral blood vessels. It is often used in conjunction with nuclear medicine scans. Patient preparation depends on the type of sonography or sonogram that is desired. For instance, an individual having an abdominal sonogram, the patient is asked to drink a little water before the procedure. A gel or lubricant is applied to the skin over the area to be examined. The technician then uses what is called a transducer, also looks like a wand, which they scan it over the area with slight pressure. The echo reflection pattern is displayed on a monitor, and then it places pictures onto that monitor to be recorded or printed. This procedure can take about 35 to 45 minutes. There is no particular aftercare needed when sonograms are performed. There are various types of radiology procedures. These procedures are used to produce data to be used in diagnosis. The most common one many of us are familiar with is called the X-ray, and the X-ray produces images of the denser tissue by passing rays through the part to expose a film. X-rays are safe to use because the exposure is brief and the rays do not penetrate deeply into the tissue. An additional radiology procedure is referred to as fluoroscopy. This examines movement. And another one is called radiography. This procedure is adding a video camera to the fluoroscope equipment and making a photographic record of the procedure. Commonly performed radiology procedures are your chest X-rays, barium swallows in your upper GI series, your QUBs or your kidney, ureters, and bladder scans, as well as your gallbladder series. Many times these procedures require special preparation that the patient must do before having these procedures conducted. Familiarize yourself with these procedures because it's important for you as a nurse to educate your patients on the proper special preparations. Additional radiology procedures are your IVPs, X-rays of bony skeleton, arthrogram, myelogram, radionuclide scan, and your computed tomography scan, also known as your CT scan. What are radionuclide scans? These studies are carried out in the nuclear medicine department, which is often a division of the radiology department. Radionuclide scans are used for various organs and soft tissue of the body attract, and concentrate certain radionuclides. A radioactive substance is injected into a vein. After organ being scanned absorbs the substance, a radioactivity scanner is passed over the area where the organ is located. CT scans for the most part are non-invasive, but sometimes consent may be required for individuals who are using any kind of contrast medium. These scans require that the patient stay in one position from 10 to 45 minutes. CT scans of various organs and part of the body are used to confirm a diagnosis, plan treatment, evaluate the treatment of patients, and also guide needle placement for biopsy or aspiration. MRI is an alternative way of getting pictures of various parts of the body without using X-rays. It is also a non-invasive method, and it's a non-invasive method of differentiating normal from abnormal tissues in the body. It is commonly used for the brain, knee joints, spine, and spinal cord and abdominal organs. Patients with metal devices implanted in the body cannot undergo this procedure because the machine emits a strong magnetic field. It is contraindicated in patients with hip prostheses, implanted pacemakers or defibrillators, artificial cardiac valves, or vascular clips or staples from a recent surgery. It is critical in assessing your patient prior to an MRI procedure to assess whether or not they have any of these contraindications. Patient teaching is very important because the procedure does require the patient to be in an enclosed environment for the most part for a very long time, and patients need to know that the duration of the test and that it is required being in a noisy environment. Patients may become claustrophobic during this test, and they may need to know deep breathing and relaxation techniques before the test is conducted. Ensure to remove any kind of transdermal medication patches, such as a nicotine patch, from the patient before they enter the MRI, because these patches may actually have a metal backing on it and may cause some burning on the skin during an MRI. And please instruct your patient while they're having an MRI procedure done that they have to lie very still during the entire duration of the procedure and to keep their eyes closed to prevent feeling of claustrophobia. Your PET scans are additional non-invasive procedures, and you can read more about the PET scans on page 423 in your textbook. These procedures are used to diagnose cancer, heart disease, and even some brain disorders. Your PET scans produce digital pictures that show abnormal cells in the body and shows differences in blood flow and oxygen uptake in the cells. Problems can be identified earlier with PET scans than with CT or MRI scans. A non-invasive procedure to evaluate heart function is referred to as your ECG. This ECG consists of waves and lines representing electrical activities during the cardiac cycle. P waves, QRS complex, and T waves are interpreted. The patient trained in interpreting the tracing can determine if the waves are normal or abnormal. Electrodes are applied to the skin. Your role as a nurse is to obtain the ECG, and it is not to interpret the tracing of the ECG. Please refer to your textbook on page 424, figure 24.4, and familiarize yourself with the positions for placing the electrodes and conducting the ECG. An additional cardiopulmonary study is your cardiac catheterization. This procedure is certainly a little bit more invasive in comparison to your ECG, which is a non-invasive procedure. This cardiac catheterization is a surgical technique that uses surgical aseptic technique. The cardiac catheterization consists of a catheter actually being inserted into a vein or an artery and then is threaded into the heart for injection of contrast media and pressure readings. The cardiac catheterization determines the function of the heart, valves, coronary circulation, as well as readings taken of oxygen concentrations at different sites of pressure in different heart chambers and cardiac output. This procedure also detects abnormal blood flows through the heart, and the coronary vessels can be detected. Angiograms and arteriograms are additional cardiopulmonary studies. They locate lesions, occluded vessels, tumors, and malformed blood vessels. Contrast medium is injected into an artery, and x-rays are then taken of the dye spreading through the veins. These procedures are used to diagnose problems in arteries anywhere in the body, such as the heart, neck, brain, or extremities. An additional cardiopulmonary study is the treadmill stress test. This can be found on your textbook on page 425. Please see figure 24.5 for an example of a photo of a cardiac treadmill stress test. This test can be used for measurements of the cardiac heart rate and blood pressure responses to controlled exercise. It is used to diagnose heart capacity, to guide convalescence from a myocardial infarction, and to determine responses to medical treatment. While having heart actions continuously monitored by ECG, the patient walks on the treadmill, pedals a stationary bike, or climbs a set of stairs. Your PFTs, or pulmonary function tests, provide information about respiratory function, lung capacity, and diffusion of gases. Spirometers and other breathing devices may be used. There are no special preparations required for these type of procedures or appointments. Okay, so we're wrapping up section 2 here. Let's review the following question. Question number 3. Which of the following diagnostic tests is a non-invasive method of visualizing soft tissue structure of the body? Is it A, ultrasound, B, X-ray, C, MRI, or is it D, CT? The correct response here is A. Remember that ultrasound is used to visualize soft tissue structures. All right, so question number 4 of section 2. You have a patient who's undergoing an electrocardiogram. Your patient wants you to explain this procedure. What is the best way you can describe an electrocardiogram, also referred to as an ECG? Is it an ECG is a record of the electrical activity of the heart? B, an ECG is a record of the position and motion of the heart produced by ultrasound waves? Or is it C, graphic record of the heart sounds? Or is it D, an electrocardiogram records or is a record of the direction and magnitude of the forces of the heart during one heartbeat? So what's the best description here for an electrocardiogram? It's A. The electrocardiogram is a record of the electrical activity of the heart, whereas an echocardiogram is a record of the position and motion of the heart produced by ultrasound waves. In your textbook, on page 423, box 24.3 provides you with an explanation of the examinations of the heart, of common tests and procedures for the heart and lungs. Please take time to review this box. Okay, let's take a quick break and review the content of section 2 before we move on to section 3.